Hi, this is Dr. Scott Hoar, and this week's Treatment Tuesday, we're going to be with Brooke Lewis. Brooke is a student at Florida Atlantic University, and she also does a little bit of fitness modeling. And she's been telling me that she's been dealing with a couple of knee issues. So, Brooke, tell me, what's going on?
Yes, I have really bad knee problems. It stops me from walking across campus too far. I'll start to have knee pain. There's limitation to my workouts. I can't do squats if it's not on the Smith machine, just to catch me in case my knee gives out on me. And I can't do lunges with too heavy, like too much weight on the sides because my knee will give out on me. There's constant cracking and rubbing, and I literally can crack my knee every time I bring it up and down.
Wow.
Yeah.
Okay. Was there ever a mechanism of injury, like a trauma?
I have been a cheerleader and I ran track, so I think it was just like wear and tear. It just progressed over time.
Have you ever gone to a doctor that diagnosed your knee with any particular injury or anything?
I've been to multiple doctors and they all said nothing was wrong with my knee. And
Seems like something's wrong with your knee. It's
yeah,
hurting,
I mean.
right? And what have you tried?
I wear a knee wrap. I ice my knee. It's definitely discouraging, to say the least. I feel like it just sets me back. When I get older, I feel like it's only getting worse. It's definitely not getting better. So I just don't want to have future problems with my knee.
You like working out a lot, yes?
Love working out.
How do you have to change your workout because of the knees?
I have to go lighter in weight. I stay away from squatting. I stay away from deadlifting. I stay away from hip thrusts. I don't want to completely cut those exercises off. Those are the best ones.
Right. Those are important compound lifts. How does the knee impact you in other parts of daily life?
I'll just have random knee pains. Even when I'm sleeping, I'll wake up in pain over my knee. I can't go on long runs.
And this is both of your knees?
Yes. I think I could say that my right is worse.
Have you ever received chiropractic care before?
I have not. I've never been to a chiropractor.
Okay. Are you nervous or anything like that?
Definitely nervous, but I have a lot of hope in you.
Okay. All right, good. What in particular are you nervous about?
I can go paralyzed for all I know.
Right.
It's just like fear.
Something catastrophic.
Yes.
We're going to do a full examination and check you out and give you appropriate treatments. So hopefully you're not going to have any catastrophic things happen with you today.
I'm really excited to get this started, and I want to crack my knee right now.
Okay. All right. Well, let's get started. Okay. So I'm going to start by feeling around with the muscles of your neck and just seeing how you're doing. We're going to go all the way head down to toe as we work towards your knees, okay?
Sounds good.
All right, good. And I'm going to start just by feeling for tension in the muscles. So you can calm down.
Okay. Yeah, I'm super tense right now.
Yeah. It's okay, and it's normal too. And so this is a myofascial release technique. So what I'm doing is I'm feeling what muscles are tighter than other muscles that could be impacting the movement of your neck. She did say that she's got some stiffness and some discomfort in both her neck and her lower back. So we're going to be addressing that on the way down to treating her knees.
This feels good.
Yeah, releasing. So with a myofascial release, as I'm feeling for which muscles have the tension, I'm actually releasing it as well. And that's why she's noticing that it's feeling pretty good. A lot of tension in those muscles, huh?
Yeah, for sure.
Mm-hmm. Good.
Am I still fighting you right now?
No, you're doing great. And now what I start doing is feeling for the movement in the joints. And whenever you have restrictions in the capsule of the joint, that impacts how you move and control your body. So I want to know, can you tell this? When we go to this side, your neck moves really nicely, and there's even some bounce at the end. It's great. When we go right over here,
Yeah, that felt good.
yeah, that's why there was that release. But I would actually like to do a neck adjustment to that segment right there.
Okay.
All right, are you comfortable with me doing that?
Yeah, I'm nervous, but it's fine. Let's do it.
Okay, because you're allowed to say no.
No, why would I say no?
Some people do.
They do? Okay,
Yeah.
don't tell me that.
All right, so we're going to go right over here, and then there's going to be a little thrust, okay?
Ooh,
Yeah.
that felt good.
And now you feel that bounciness return. That's cleaning up that joint and the movement in there. Good. And there's a little bit right there. Do you feel that?
Yeah.
You ready?
Yeah.
Good.
Yeah.
Just a little guy. All right. All right. So now I'm just feeling around here. Plenty of stiffness right there. Oof. You feel what I'm talking about?
Yeah, definitely.
Okay, so I'm going to give it a little thrust over here as well. Good. A little bit right there. Breathe out. Good. Head back to neutral. You doing okay?
Yes.
Are you liking this?
Yes, I like it a lot.
All three, okay. All right, I'm going to see how your hips are moving. A little stiff right there. Not too bad. Try to relax.
Okay.
I'll tell you when I'm going to do something, okay?
Okay.
All right. I actually do want to mobilize your hip down a little bit like that as I go into external rotation because I'm not really liking your hip's ability to move. And since we're about to be dealing with your knees, how your hip moves has a huge impact on how your knee feels. All right, muscle test. I'm going to push down like that. Don't let me go.
Ooh.
And again, ready, go. Not so good. Pushing there, ready, go. A lot stronger, right?
Yeah.
Okay, so what we're going to do is do an adjustment to the segment where the nerves that come out of there actually control the hamstring. So it's indicating your hamstring being weak is indicating that, hey, there might be something going around here going on in your lower part of your spine. So I want you to turn on your side, this side up, facing me. So this is your first little back adjustment, huh?
Yeah. Can you tell?
You just seem nervous.
I am nervous, but it feels really good. Like I haven't been in pain yet.
Yeah?
Yet, keyword.
Yes. All right. So, like I said, the L5 segment, which is right here, that's where the nerves come out that control that hamstring. So, what I'm going to do is bring you over here. Okay. And there will be a little thrust, okay?
Okay.
Deep breath. Good.
Ooh, that felt good.
Very good.
I needed that.
Yeah?
Yeah.
Go face down. Let's see what it did. Muscle test. Pushing there. Don't let me go.
Wow.
Way stronger, yeah?
I'm impressed.
Good.
It's
All right.
magic.
Bring your knee up.
This knee?
No,
Pushing. This
just
knee?
like that. I'm going to push it down into the table. Don't let me do that. Go. Not good.
No.
Again?
Okay, no.
This guy? Pushing down. Let's do both of those again. Pushing down. Okay? And this guy. Down a little bit more. Pushing down.
No, that knee's super weak.
Super weak, huh?
Yeah.
All right, turning this side again. So, that time your glutes tested weak. All right, so the nerves that come a little closer out of the spine, kind of towards the sacrum, is what we're going to want to adjust this time. Good. Deep breath. Breathe on out. Good. Face down. So notice there wasn't that big release, big crack. And let's test here. Raise up. Pushing down. Don't let me go. But it was way stronger.
Yeah.
So the crack is not the indicating factor that, hey, this was a successful maneuver. This was not a successful maneuver. So great. Why don't you flip around on your back? All right. So I'm feeling for how your hips move. I don't like this. Your right hip is a little stiff into external rotation. Okay? If your hip can't move well, it puts abnormal torque on your knee. So that's probably a contributing factor to what's going on here. So I'm going to do a quick little adjustment where basically I take your hip and then I'll do a little yank like that, okay? Try to relax.
I'm trying.
All right. Good. Good. And you'll notice already it externally rotates a little bit better.
Yeah.
It doesn't mean it's fixed, but it's important to get a little bit more range of motion, especially for the second phase of your treatment today, the progressive rehabilitation, since we're taking some of these imbalances in your body and we're reducing them, and then we're going to start changing kind of your muscle memory, how you control and move your body, which is going to make the lasting difference for you.
Okay.
Okay, muscle test, pushing down. Don't let me. Ready? Go. Again. Ah, it's so good.
No, it doesn't stand a chance.
This one. Ready? Go. A lot stronger, right?
Yeah.
So turn, face that way. Perfect. Remember, head up.
Head up.
Yeah. Good. So what tested weak there was the rectus femoris, okay, which is one of your hip flexor muscles. And most of the innervation comes out of right there. So we're going to do a little manipulation, okay? Breathe out. Good. And lay on your back. Pushing there. Don't let me go.
Wow.
Much better, huh? Good. Pushing down and out like that. Don't let me. Okay. Nothing.
That's really bad.
Down and out. Don't let me. Nothing there. Okay. Both of those were weak. I'm going to pull just this leg towards me like that.
Okay.
Don't let me. Ready? Go.
Okay, wait, do that again. I wasn't concentrated.
Ready? Go. All right. This guy. Ready? Go. Both of those felt a little weak to me. I'm going to push down and in. Don't let me. Go. Not good. Down and in. Don't let me. Not
How
good.
have I even been living like this?
Well, really, that's a good question.
Like, is this the worst you've ever seen?
Not even close.
Oh, wow.
Pushing out like that. Don't let me. Ready? Go. Again. Not good. Okay. I'm going to spin it out like that.
Okay.
Don't let me do that. Ready? Go. Again. So that was a little stronger than this one, wasn't it?
Yeah.
Okay, turn on your side face. So what we're trying to do is get all these nerves and all these stabilizing forces of your lower back, your pelvis, and your hips firing first before we worry about your knee, because there's probably a lot of contributing factors to your knee issues from instabilities in your low back and core. Deep breath, breathe on out. Good. Lay on your back. Pulling out like that. Don't let me. Ready? Go. And it was already better, wasn't it?
Wow.
Okay, let's test some of these other ones that were weak earlier. Pushing down and out. Don't let me. Ready? Go. Strong, yes?
Yes.
Down and out. Ready? Go. Much better. Pushing down and in. Don't let me. Good.
Wow.
This way. Good. Okay, so the left ankle dorsiflexes a lot easier than the right ankle. Have you ever noticed that?
No, I've never.
Did you ever injure this ankle?
No, not that I know of.
Okay. That could very well be another contributing factor. We'll do some muscle tests. I want your foot up and in like that. Hold it right there. I'm going to push from this side doing that. Don't let me go. Good. Point and in. Hold it right there. I'm pushing from right here. Don't let me.
Okay.
Ready, go. And that's not strong, is it?
Yeah.
Okay. Feet are a little flat. Not too bad. I'm going to do a little navicular adjustment here. See if we can't get your foot function improving a little bit. So hold on to the table. I'm going to yank you here like that.
Okay.
Don't let me, okay? And then relax your foot. Good. Let it go.
Sorry, I'm focusing on too much.
Yeah, it's okay. Good. Okay. Now point and in. Hold it right there. I'm pushing from right here. Don't let me. Ready?
Okay.
Go. And I would say that's not improved. So I'm going to grab an activator device. Hold on one second. It's just a nice instrument that I like using because it's very, very specific. Yeah, let it go.
Well, now I'm nervous. Oh, shit. What the hell is that?
Okay. Pointing and in. Hold it right there. Push from right here. Ready? Go. That's a little bit better. It's not perfect. Up and in. Hold it right there.
Okay.
I'm going to push from right there. Don't let me go. That's great. Pointing and out. I'm going to push from right there.
Okay.
Don't let me. Ready? Go. Yeah, that's good. All right. So still a little bit weak, really, towards your posterior, tibialis posterior muscle over here in your foot, which does attach up to the calf, so it impacts the knee.
It's probably why my calves are small.
You have small calves?
Yeah, they won't grow.
They won't grow. All right, I'm going to do one more adjustment here on the foot. Try your best to relax.
Okay.
Good. Which is not easy, huh?
No, I'm really ticklish.
Oh, that's what's happening right now? I'm tickling you? Good. All right. And now we check your dorsiflexion, which is way better already.
Yeah, wow.
Good. And I'll point it in. Hold it right there. Push from right here. Don't let me. Ready? Go. And that's stronger. Wasn't it?
Wow.
There you go. Let's check on the other side here. Up and out. Hold it right there. I'm pushing from right there. Don't let me. Great. Pointing and out. Push from right there. Don't let me. Great. Pointing and in. Push from right here. Don't let me. Uh-huh. Same one was weak, wasn't it? Mm-hmm. Up and in. Push from right here. Don't let me. Again. And that's kind of weak too. Okay, relax. Okay. We'll do the navicular adjustment. Try to relax that foot.
Okay, I'm relaxed.
Is that what it is? Is that what you are?
Not really.
I don't think so.
That thing scares me.
Yeah. Point and in. Hold it right there. Push from right here. Don't let me. A little bit better. Pointing and in. Push from right there. Don't let me. Go. Good. And I'm going to give you one more little yank here, okay?
Okay.
Let it go. Let it go. Good.
Oh, there we go.
All right. Good. Okay. Now finally we get to the knees. All right. So your flexion range of motion's awesome. So is your extension. It's actually a little hyper. Any discomfort when I do that?
No.
Okay. We'll check you out over here too. Same deal. So the range of motion is just fine. We'll do a little bit of orthopedic testing to make sure you have integrity with your ligaments. Try to let it go. Relax. That's fine. All right, good. So I'm going to do another muscle test here with your foot. It's kind of turned in here.
Okay.
I'm going to spin it out.
Okay.
Don't let me do that. Go. And that's a little bit weak. Same sort of thing. Foot turned in. I'm going to spin it out. Don't let me go.
Ooh.
That's just a little bit weak.
Okay.
So we'll do a quick little knee adjustment. There. And now we'll do that same muscle test. Spin it out. Don't let me. Ready? Go. And that was a little stronger, wasn't it?
A lot stronger.
Same deal over here. Good. Let that go. Good. I'm going to spin your foot out. Don't let me go. Much stronger. All right. So that's a good start. Now I'm going to actually check out the meniscus within the knee and see if there's any fixation or restriction. Right there, it's moving just fine. Let it go here. So it's pretty good there. We'll check another spot of the meniscus. It's almost like it goes too far. You feel how far it's spinning?
Yeah.
There's a certain amount that your shin bone, the tibia, should be able to spin or rotate on your knee, yours is going too far.
So I need more shin bone.
You need more stability in your knee to limit the inappropriate motion. Good. That's fine. All right, let's check out this knee. Does that make sense?
Yeah, I get what you're saying.
Too much motion.
Is that common?
Common.
Okay, that means no.
Well, sure, it's common. That doesn't mean it's okay.
Yeah.
Lots of people have knee pain, you know? All right, good. So now what we're going to do is we're going to start your progressive rehabilitation and make sure we're giving you exercises that allow you to stay with a neutral, good posture of your knee while moving it versus rotating all over the place.
Okay.
Okay?
Sounds good.
All right, let's go. Okay, so now we're going to start our progressive rehabilitation. We went through the chiropractic treatment and we found plenty of imbalances, right, in how she was moving her body, and we got a lot of things firing, so that's good. There's this little window for about 30 to 60 minutes where her body is moving really, really well. So now we want to do the progressive rehabilitation so that we can actually change kind of her muscle memory, her posture, so we actually have lasting positive benefits going forward. So obviously, what I was saying was the rotation of the knee is excessive and not helping her meniscus. And I really do think that's what this issue is. This is a meniscus
Yeah,
problem.
I think so too. I used to say I tore my meniscus,
Yeah.
but it never came up.
Sure. And so what we want to do is make sure her hip moves as well as possible so that it minimizes extra forces, rotational forces on her knee. What did you think of that first exercise, the single leg glute bridge?
I didn't think it was going to be hard at first. I'm like, okay, I always like this is easy work for me, and then it ended up being harder than what I expected. Definitely a lot harder.
Yeah. Could you feel the difference in the stability from one hip to the other?
Yes, for sure.
Right. And then we did the correction where I had you push from the outside.
Yeah.
So that we call that a core activation. Once you turned on those core activators, suddenly you had way better stability and control with your hip, right?
And it became easier, correct.
You don't actually have ideal posture and positioning while you're moving it.
That's true, because sometimes I fall over when I'm doing like lunges. Not like fall over, but I'll lose like my balance.
Yeah. Okay, so pop your pelvis up. Good. And now what I want you to do is go forward with your pelvis. The second exercise, the side plank. What was that like for you?
Deadly. Literally broke out a sweat. I struggled with that.
Is neutral. Okay?
Got it.
And it was so foreign to you
Yeah.
to get in that position. And you could feel gravity is trying to put lateral movement into your spine, into your hips, into your pelvis, even into your knee right now. And you're learning to have the stability and the control to not allow it. So this is lateral stability and control.
Got it.
So this is a good exercise for you to be doing.
I think I'll have abs if I do those.
Well, it's actually a wonderful abs exercise.
Yeah, seriously.
Okay. What'd you think?
I feel like $1,000,000.
Yeah?
Like seriously, I feel a lot better. I can't wait to like go and work out.
But you have some stuff to work on right now.
Yes, I do. I'm gonna go home and work on my exercises.
So what would it be like for you to actually have stability and control in your hip?
I feel like it would be life-changing for sure, because I'd be able to do everything I can't do, and that's the reason for it all. After all, I'm glad we figured it out.
Yeah, we did find there was some instability in the right hip, as well as some stiffness in the right hip. Well, that's what happens, and you know, it's not unique to you.
Yeah.
As we live our daily lives, whether we're super active like you or we're inactive, we develop these imbalances.
Yes.
And if you don't have somebody to go to find them out, then they just become bigger and bigger imbalances to the point where they they can cause either pain, injury, premature arthritis, and degenerative changes and that sort of thing. Identifying these dysfunctions, but then being able to address it is just a big deal. I recommend you do those exercises daily for right now. Certainly do them before you're active. That way it kind of primes your stabilizers so you can actually move better.
Cool. Got it.
What does your life look like going forward with healthy knees?
I feel like I'll become stronger just in general. I'll be more toned, everything that I'm like trying to shoot for, I'll be able to do. Not just like lifestyle, activeness, all of it.
Yeah.
I'll be able to go on walks and not struggle. I'll be able to do the weight that everyone else does.
So coming into this experience, you were pretty nervous. What was your experience and how do you feel about it now that you're on this side of it?
It literally didn't hurt at all. I was even asking people, like asking my friends, like, hey, have you guys ever been to a chiropractor? How bad does it hurt? And like even some of them are like, it depends, like the hips hurt, blah, 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 saying like different things. So even when you were like, well, I'm going to rotate your hip, I was like, oh God, this is the part where I'm going to scream. It did not hurt. Like on a scale of pain-wise, 1 to 10, it was like literally a 2. Okay. It didn't hurt. It was more of like a relief feeling. Like I literally feel like I lost weight from all the air bubbles being out of
pressure going down in your system.
I definitely recommend it.
That's great.
Yes.
All right. Well, thank you so much
Thanks.
for being our patient today.
I
hope you feel better as a result of this. And of course, if there's anything we can do for you going forward, please let us know.
Will do.
You can find Brooke on Instagram. It's Brooke Lewis with 3 S's. And of course, thank you for watching. Don't forget to hit the like button, leave a comment below, and hit the subscribe button. Look for our next treatment next Tuesday.